So let's talk about the newborn. So when the newborn is born, when the baby is born, the medical professionals assess their health. So one of the things they do is to take their APGAR, and that looks at several different things to come up with a score out of 10 that kind of determines how well the baby's doing. So they look at heart rate, respiration, muscle tone, reflex response, and color. Each of those is given a score of 0 to 2, 2 being the best, 0 being the worst. And they do that twice to kind of check the baby right after birth and then after a little bit when the blood's had a chance to circulate. Anything under 5 is cause for concern, and anything under 3 is kind of critical, needs to be resuscitated. They also use the Neonatal Behavioral Assessment Scale by Teaberry-Brazelton. This isn't something that's routinely used, but if there's risk factors or maybe the APGAR scores are low, that they can use that to follow up to determine what might be going on. They also do heel stick blood testing. And in California, that now tests for 80 different genetic and congenital disorders. So it's pretty valuable, even though I think it's traumatic for mom to watch that happen. And they also screen for hearing problems as well as heart problems while the baby's in the hospital. So there are some problems that can happen for newborns. So let's look at those. So the first is anoxia, and that would be lack of oxygen to the brain. And so this could come from lots of different things, but commonly it would be an issue with the cord. So before the baby's out and can breathe with their lungs, if that cord is compressed, which is how the baby's getting oxygen through mom, it can cause some issues. Babies that are born under 5 pounds, 8 ounces are considered low birth weight. And then babies that are born before 37 weeks, so full-term pregnancy is 40 weeks. So if they're born 3 weeks or more early, they are considered preterm. Both of those babies on the right-hand side are preterm. They happen to be my twins. And my son is on CPAP in that top picture to help him breathe. So his APGAR scores were 2 and 3. So he needed a lot of help when he was born, and they were born at 32 weeks. And then on the bottom is my daughter, and she was definitely small for date. So small for date is when you weigh less than 90% of babies at the same gestational age. And so when she came out, she wasn't even 3 pounds. So she was itty bitty, but you can see that she's not on any respiratory support. Her APGARs were actually 8 and 9. So she was doing much better, even though she was itty bitty. And on the flip side, you can have a baby that's born after 42 weeks, so they're post-mature. And then the worst possible outcome would be stillborn, and that is when the baby dies in the womb after that 20 to 24 week period where they would be considered potentially viable on the outside of the womb. So what happens with full-term newborns, because these things don't necessarily qualify to preterm infants or maybe even post-mature. So average size is about 7.5 pounds and about 20 inches long. So this little guy is just under average. Their head is about 25% of their body length. And all of their brain cells, their neurons are present, but the connections have yet to be made, or many of the connections have yet to be made. They tend to have a misshapen head, especially if they were born vaginally, because their head has to squish to get through the vaginal canal, and thankfully their heads are moldable, and so they may come out with kind of a cone-shaped head or even a bruised head. Babies may have lanugo, which is a downy body hair, and you can see that over here in this image. This is actually 2 different babies' shoulders. They may also come out with vernix, which is a waxy white substance covering their body. They tend to have enlarged genitals, maybe even swelling of the breasts due to the hormones in the womb. And then you have to deal with the umbilical cord, which they're actually in the process of cutting here in this picture. So often we see those adorable Ann Geddes type of pictures of newborns, and that's what we get in our head, when reality's not quite as adorable. But with time and maybe a little bit of posing, we can get to that adorable feature. So some other things about newborns to know: they sleep about 16.5 out of the 24-hour period, but obviously not all in one chunk. So they wake often, typically every 2 to 3 hours. They are equipped with reflexes, such as a sucking reflex and a rooting reflex, which helps them feed, reflexes such as breathing and blinking, and then some other ones like grasping and stepping. And you're going to learn more about those when we look at the physical development during infancy and toddlerhood. And as far as their sensory capacities, because there's very little light in the womb, virtually none, vision doesn't develop very well in the womb. So they come out with a really poor vision. But what's really interesting is about where their vision is greatest. But you're going to learn more about that later too. They happen to have very keen hearing, and they can actually recognize music and rhythms that they heard in the womb. And they definitely recognize their mother's voice because they've been listening to it their entire fetal development period. They're sensitive to touch, temperature, and pain. So there's when you talk about things like circumcision, that comes in, that they do actually have those senses. They also have innate taste preferences. So if you put different flavors in newborn babies, they make facial expressions that can kind of show you what they like and what they don't like. And perhaps not surprisingly, they like sweet. And breast milk is actually sweet. And it's also really interesting to know that they perceive the world in an intermodal way, right? So they don't just use one sense, they integrate those senses. And if you watch the 9 months that made me, that is something that video talks about. So that is it for the newborn. You're going to learn a lot more about development in the coming chapters.